Things that can help boost and maintain a strong immune system. 1. Vitamin D. It was previously known to be important for calcium metabolism and bone health, but is now known to also play an important role in regulating the innate and adaptive immune responses of the body. Deficiency in vitamin D puts one at increased risk for autoimmune disorders and susceptibility to infection. 2. Sunlight exposure. UV light from the sun triggers the production of vitamin D in our skin. Vitamin D modulates certain immune functions that fight infections. It also improves immune function through a separate mechanism. Scientists from Georgetown University Medical Center discovered that low levels of blue light, found in sun rays, makes T cells move faster. Cells are immune cells that protect the body from pathogens and cancer cells. The benefits of vitamin D: fights disease, reduces depression, boosts weight loss. Vitamin D deficiency. Food sources. How much you need. How this works. Sunshine vitamin. Vitamin D is sometimes called the sunshine vitamin because it's produced in your skin in response to sunlight. It's a fat-soluble vitamin in a family of compounds that includes vitamins D1, D2, and D3. Your body produces vitamin D naturally when it's directly exposed to sunlight. You can also get it through certain foods and supplements to ensure adequate levels of the vitamin in your blood. Vitamin D has several important functions. Perhaps the most vital are regulating the absorption of calcium and phosphorus, and facilitating normal immune system function. Getting a sufficient amount of vitamin D is important for normal growth and development of bones and teeth, as well as improved resistance against certain diseases. If your body doesn't get enough vitamin D, you're at risk of developing bone abnormalities such as soft bones, osteomalacia, or fragile bones, osteoporosis. Here are 3 more surprising benefits of vitamin D1. Vitamin D fights disease. In addition to its primary benefits, research suggests that vitamin D may also play a role in reducing your risk of multiple sclerosis, according to a 2006 study published in the Journal of the American Medical Association. Decreasing your chance of developing heart disease, according to 2008 findings published in Circulation Trusted Source. Helping to reduce your likelihood of developing the flu, according to 2010 research published in the American Journal of Clinical Nutrition Trusted Source. 2. Vitamin D reduces depression. Research has shown that vitamin D might play an important role in regulating mood and warding off depression. In one study, scientists found that people with depression who received vitamin D supplements noticed an improvement in their symptoms. In another study of people with fibromyalgia, researchers found vitamin D deficiency was more common in those who were also experiencing anxiety and depression. 3. Vitamin D boosts weight loss. Consider adding vitamin D supplements to your diet if you're trying to lose weight or prevent heart disease. You can find a great source of vitamin D or supplements in I-Fern D. In one study, people taking a daily calcium and vitamin D supplement were able to lose more weight than subjects taking a placebo supplement. The scientists said the extra calcium and vitamin D had an appetite-suppressing effect. In another study, overweight people who took a daily vitamin D supplement improved their heart disease risk markers. Beware of deficiency. Many factors can affect your ability to get sufficient amounts of vitamin D through the sun alone. These factors include being in an area with high pollution, using sunscreen, spending more time indoors, living in big cities where buildings block sunlight, having darker skin. The higher the levels of melanin, the less vitamin D the skin can absorb. These factors contribute to vitamin D deficiency in an increasing number of people. That's why it's important to get some of your vitamin D from sources besides sunlight. The symptoms of a vitamin D deficiency in adults include tiredness, aches and pains, and a general sense of not feeling well. Severe bone or muscle pain or weakness that may cause difficulty climbing stairs or getting up from the floor or a low chair, or cause you to walk with a waddling gait. Stress fractures, especially in your legs, pelvis, and hips. Doctors can diagnose a vitamin D deficiency by performing a simple blood test. If you have a deficiency, your doctor may order X-rays to check the strength of your bones. If you're diagnosed with a vitamin D deficiency, your doctor will likely recommend you take daily vitamin D supplements. If you have a severe deficiency, they may instead recommend high-dose vitamin D tablets or liquids. You should also make sure to get vitamin D through sunlight and the foods you eat. Food sources of vitamin D. Few foods contain vitamin D naturally. Because of this, some foods are fortified. This means that vitamin D has been added. Foods that contain vitamin D include salmon, sardines, egg yolk, shrimp, milk, fortified cereal, fortified yogurt, fortified orange juice. Fortified. It can be hard to get enough vitamin D each day through sun exposure and food alone, so taking vitamin D supplements can help. How much do you need? There has been some controversy over the amount of vitamin D needed for healthy functioning. Recent research indicates that you need more vitamin D than was once thought. Normal blood serum levels range from 50 to 100 micrograms per deciliter. Depending on your blood level, you may need more vitamin D. The Institute of Food and Agricultural Sciences reports new recommendations based on international units (IUs) per day. IUs are a standard type of measurement for drugs and vitamins. IUs help experts determine recommended dose, toxicity, and deficiency levels for each person. One U is not the same for each type of vitamin. An U is determined by how much of a substance produces an effect in your body. The recommended IUs for vitamin D are: children and teens, 600 U; adults up to age 70 to 600 U; adults over age 70 to 800 U; pregnant or breastfeeding women, 600 U. Building strong bones. Exposure to the ultraviolet B radiation in the sun's rays causes a person's skin to create vitamin D. According to one study from 2008 trusted source, in a 30-minute period while wearing a swimsuit, people will make the following vitamin D levels: 50,000 international units IUs in most Caucasian people, 20,000 to 30,000 IUs in tan people, 8,000 to 10,000 IUs in dark-skinned people. The vitamin D made thanks to the sun plays a big role in bone health. Low vitamin D levels have been linked to rickets in children and bone-wasting diseases like osteoporosis and osteomalacia. Cancer prevention. Although excess sunlight can contribute to skin cancers, a moderate amount of sunlight actually has preventive benefits when it comes to cancer. According to researchers, those who live in areas with fewer daylight hours are more likely to have some specific cancers than those who live where there's more sun during the day. These cancers include colon cancer, Hodgkin's lymphoma, ovarian cancer, pancreatic cancer, prostate cancer. Healing skin conditions. According to the World Health Organization (WHO) trusted source, sun exposure might help treat several skin conditions, too. Doctors have recommended UV radiation exposure to treat psoriasis, eczema, jaundice, acne. While light therapy isn't for everyone, a dermatologist can recommend whether light treatments will benefit your specific skin concerns. Additional conditions. Research studies have revealed preliminary links between sunlight as a potential treatment for several other conditions. These include rheumatoid arthritis, RA, systemic lupus erythematosus, inflammatory bowel disease, thyroiditis. However, more studies need to be conducted before researchers can conclude that sunlight can be a treatment for these and other conditions. You can get all of these through supplement even without sunlight. How? I-Fern D is the answer. I-Fern D daily dose of sunshine, even without the sun. Study says that vitamin D can prevent and treat cancer cells, pneumonia, diabetes, migraine headache, heart disease, depression and anxiety, hypertension, Alzheimer's disease, stroke, Parkinson's disease, autoimmune disease, lupus, vitiligo, etc., multiple sclerosis, hyper and hypothyroidism, infertility and PMS, rheumatoid arthritis, psoriasis, gout arthritis, acne, osteoporosis, eczema, kidney problem, obesity, asthma, preeclampsia. This is FDA-approved, halal, Quali-C, Quali-D, Quali-Blend and Super brands. Available Davao distributors. Davao City. If you want to be a distributor of I-Fern D, please call the number. Contact this number: 0917-718-7084 Globe, 0929-201-5739 Smart, 0923-832-2738 Sun.
The sun is your best source of vitamin D, but too much sun can burn you, unfortunately. And what if you can't get some? To whom are you gonna run? Take I-Fern D every day for your dose of sunshine, even when it's cloudy, even when it rains, morning or night. You'll always be alright. I-Fern D, vitamin D even without the sun. Talk to your I-Fern distributor for more information about I-Fern D today.